Hey everybody, this video is going to be an introduction to the mental health disorder known as anorexia, or more formally anorexia nervosa. The definition of this disorder, the true definition, I feel like a lot of us have an idea of what it is, but the true definition is an intense fear or an intense avoidance of gaining weight because of distortion of our own body image. And usually this comes with an increased amount of exercise, an increased amount of dieting. And the take-home message is that these people have a body weight below the healthy or ideal value. And the best way to really quantify that is they have a BMI, body mass index, of less than 18.5. And that is pretty slender, that is pretty skinny. So what we're dealing with here with anorexic people are people that, if you saw them on the street, they would strike you as being especially skinny or especially slender. And one interesting thing about anorexia is that it is a mental health disorder, and one thing that typifies it from other types of disorders is that these people will still see themselves as overweight. So even though the definition here is that their BMI is less than 18.5, which is very skinny, they will still see themselves as overweight, and they'll still try or still attempt to lose even more weight. Now, how do they lose that weight, or what methods do they go by? Well, there are two main subtypes of anorexic people. And the first one is restrictive. Now, what does restrictive mean? Well, think about the word restrictive, restriction. These people will restrict their diets. These are the people that will abstain from eating food. They will go crazy amounts of time without meaning a long amount of time without eating anything, or eating very, very, very little. And the second type here is going to be binge purge. Now, binge purge, if you are part of mainstream society, usually we think of binging and purging with another disorder called bulimia, which we have a couple other videos on. But anorexics actually can have a binge purge subtype, meaning that they binge on food, or they consume a large amount of food, an unhealthy almost amount of food. It might even be unhealthy food. It might be like they eat like 3 whole chocolate cakes, or it might be that they eat 1 hamburger, whatever it is. They binge on food and then they purge it, meaning that they vomit that food back up, or they take laxatives, or they do some manner so that the nutrients and the fats and everything inside of that food is not absorbed in their body. Now, why are they doing this? Because they have it's an actual mental health disorder where they perceive themselves in the mirror or on the scale or whatever it is as overweight. This is not them, understanding that they're skinny and just wanting to look different. This is actually they perceive themselves to be overweight or unhealthy, so they're trying to fix it. So really, you can't really you shouldn't blame anyone with a mental health disorder, but you especially can't blame these people because they're really trying to be healthy. In their mind, they're trying to be healthy, whether it's by restricting their diet, changing their diet, or over-exercising. Some risk factors for anorexic people include being female, having a low self-esteem, and having a high socioeconomic status. So we're talking about, the rich girls who lack confidence are kind of like your stereotypical. We shouldn't make generalizations, but your stereotypical anorexic are. It's not going to be a poor man, who's confident. It's going to be the exact opposite of that. Excuse me. Anorexia is also commonly associated with obsessive compulsive disorder, or OCD. These mental health disorders usually go hand in hand. So if someone is constantly obsessing about their BMI and their body image, well, they might be obsessing about, I need to be skinnier, and they go into compulsions where they do not eat, or they eat and then purge, that sort of thing. As far as treatment for anorexia, we don't typically go to medications, although medications might help. It's much more based in therapy. And so you need to talk with these people, convince them and work through their disorder, see what else is going on in their life, see if there's some sort of triggering factor, convince them that they are in fact too slender and we need to get their BMI up. Sometimes you have to hospitalize these people to make sure they're getting the appropriate amount of calories. And then, calorie counting obviously works as well. So maybe you have to wake this person up every 4 hours and make sure they get down to 300 calories and they keep those calories in their body, that sort of thing. There's a lot of different strategies out there, but the key thing about anorexia is that typically we don't go to drugs, we stay in the psychotherapy realm. The big parts here, anorexia nervosa, these people, they think they're overweight, they don't think that anything that they're doing is wrong, they will overexercise, they will change their diet either through restriction or through binging and purging, and they need to be treated with psychotherapy. Now, what happens if we don't treat them? What are the side effects of being anorexic? There's all sorts, as you can imagine, if you're not getting the proper amount of nutrients or the proper amount of electrolytes or fats or calories or whatever you want to say. Everything from decreased bone density because you're not getting enough calcium, to fractures, to decreased thyroid function, constipation, having dry skin, brittle nails. Amenorrhea, or the lack of menstruation, is big in females. Anemia, electrolyte disturbances, and obviously, you can imagine if you let this go on too long, this can even be lethal, where not getting enough nutrients and having too low of a BMI and not being treated, and never understand that anything's wrong and just thinking that you're still overweight despite your efforts, this can be very bad and lead to poor consequences. And that's Introduction to Anorexia. Thank you.